Hello, I'm Jung from Wongang University Sambon Hospital. We reported live database study of urinary stone composition in South Korea in investigative and clinical urology. It's a great honor to interview for our study. Urolithiasis is one of the most common diseases and a relatively high recurrence rate combined with a large monetary impact emphasizes that the prevention of recurrence of urolithiasis in patients is crucial to the patient's quality of life and the economy of the country. Knowledge of the urinary stone composition can help prevent future stone formation, and identification of stone composition facilitates choosing the necessary and specific treatment of patients with urinary stone disease. Thus, in the current study, we analyzed the characteristics of stone composition using a large Korean database.
A total of 33,078 stones submitted to Green Cross laboratories from January 2014 to June 2019 were analyzed. FTIR spectrometer was used to analyze stone composition. We classified the stone composition into 4 main groups according to the Mayo Clinic classification, and for efficient statistical analysis, less than 1% stone composition was excluded, and the carbonate, apatite, and brucite groups were combined into the calcium phosphate group. Finally, a total of 32,807 stones were classified into 4 main groups. Geographic region was divided into 4 categories: the capital region, Chungcheong region, Honam region, and Yeongnam region. The Gangwon region was excluded because data were not collected by Green Cross laboratories in this region. Overall, there are a total of 33,078 cases, composed of 21,025 men and 12,053 women. The mean age of the patient was 56 years. As shown in Figure 1, women were more frequent than men in the steroid group and in the calcium phosphate group. Men were more frequent than women in the uric acid group, and there was no difference in the percentage of each gender in the calcium oxalate group. As shown in Figure 2a, the male to female ratio was 1.75 for total stones. In addition, the highest MF ratio was found in the uric acid group, followed by the calcium oxalate group, steroid group, and calcium phosphate group. Interestingly, in Figure 2b, the total MF ratio decreased over 4 years from 2014 to 2018. The influence of age on stone composition is shown in Figure 3. The age group with the highest percentage of calcium oxalate stone composition was 09 years old. The percentage of calcium oxalate stone composition then decreased with increasing age. The age group with the highest percentage of steroid stone composition was 1999 years old. The percentage of uric acid stone composition increases with age was highest in 89 years old. The age group with the highest percentage of calcium phosphate stone composition was 10-19-year-olds. The influence of geographic region on stone composition is shown in Figure 4. The area with the highest percentage of steroid stone composition was the Chungcheong region, and the area with the highest percentage of the uric acid stone composition was Honam region. The percentage of the uric acid stone composition in the capital region tended to be lower than in other areas. Interestingly, uric acid stone is associated with metabolic syndrome, and according to Metabolic Syndrome Fact Sheet in Korea 2018, the capital region tends to have a lower incidence of metabolic syndrome than the Chungcheong, Honam, and Yeongnam regions. These findings are keeping with the low rate of uric acid stone composition in the capital region. In the calcium phosphate group, there was no difference in the percentage of each region. As shown in figure 5a, the percentage of uric acid group decreased from 22.4% in 2014 to 18.7% in 2018. The percentage of calcium phosphate group also recently decreased from 7% in 2014 to 3% in 2018. The percentage of calcium oxalate and steroid group showed no tendency to increase or decrease over the 2014-2018 time frame. As shown in figure 5b, the number of stone analysis per year tended to increase from 2014 to 2018. The trends in stone composition by month are shown in figure 6a. Among all the groups of different stone compositions, the calcium oxalate group had the highest percentage in August and the lowest percentage in October. The uric acid group had the highest percentage in October and the lowest percentage in February. The calcium phosphate group was the highest in February and the lowest in September. There was no difference in the percentage by month in the steroid group. The influence of season on number of stone analysis based on stone composition is shown in figure 6b. The number of stone analysis cases was the highest in summer and the lowest in winter. The calcium oxalate group had the highest percentage in summer and the lowest percentage in spring. The calcium phosphate group had the highest percentage in winter and the lowest percentage in summer. In the steroid group and the uric acid group, there were no differences in the percentage by season. Conclusions. The total number of stone analysis by year tended to increase. There were differences in the percentage according to gender, age, geographic region, month, and season for each stone composition. In calcium oxalate and uric acid groups, the ratio was higher in men. In steroid and calcium phosphate groups, the ratio was higher in women. The percentage of patients with uric acid stone composition increases with age, but the percentage of those with calcium oxalate stone composition decreased. Similar to the low incidence of metabolic syndrome in urban areas, uric acid in the capital region tended to be lower than other areas. The number of urinary stones was highest in summer and lowest in winter. Identifying these differences based on the stone composition is essential for the treatment and prevention of urinary stones. Thank you.